Well, from juggling jobs, kids, and family activities, it can be hard to remember to take time for our mental and physical wellness. Something doctors say you shouldn't skimp through, though, is breast health. New research from breastcancer.org shows about 1 in 8 women in the U.S. will develop invasive breast cancer over the course of her lifetime. Next month, there's a special event geared toward teaching everything you need to know about breast health. Here to talk some more about it, Dr. Shala Massoud from Jacksonville's UF Health Breast Cancer Center this morning. Thank you so much for joining us.
Thank you for having me.
Yes, we want to talk about this. It's a very important subject that we have our doctors. They speak with us about it pretty much every time we go for our annual exam.
Exactly.
But it hits so many people in so many different ways. So many people have been touched by this, family members, whatnot. Why is it so important, to start thinking about this, maybe even in your 20s?
Well, the reason that it's important to be aware of your breast health from early on is simply because we are in the stage right now that when breast cancers are detected early, this is practically a manageable disease. This is something that the people live with that with long time. And this is something that is no longer really looked at as a fatal disease. It is looked at a chronic disease.
Right.
And therefore, you practically guarantee the fact that you can live long and you can live normal life if you detect cancer early and you can manage it properly.
Yeah, and in order to detect it early, you've got to know what you're looking for.
Absolutely. And there are multiple factors in breast cancer that one has to understand. One is the fact that breast cancer is not a single disease that can be looked at, one therapy, one approach, and this is for all.
Varies from person to person, and also, of course, I'm assuming depending on when you detect it.
Absolutely, and the concept is that the factors associated with increased risk for breast cancer is different from every individual, and people that they have family history of breast cancer or ovarian cancer or other cancers are predominantly more susceptible to develop breast cancer. Therefore, it's very important that people would be aware of their family history, people would be aware of their breast and how does it look like. And early on, start to try to really make sure that when they go to the physicians, they share their family history with their physician and then follow the guidelines in respect to the breast cancer screening mammography. And every time that they see something abnormal in their breast, they need to refer to their physicians.
Okay.
This is not something that you can just leave it on the basis of he said, she said.
Right.
This is something that needs attention.
So if your doctor or you find something, or you see your doctor, how important is it to go get a second opinion?
You bring a very, very important concept that actually is very close to our heart, and that is, again, breast cancer is different with every patient, and there are cancers that they are very low grade. They could be really treated very different from cancers that they're aggressive, and in those scenarios that they need a different kind of attention and approach. And right now we have this capability of trying to really look into the genetic makeup of breast cancer, look at the biomarkers, look at the morphology, and could tell a person what kind of cancer they have. And along the line of that, the kind of therapy associated with that cancer is very well established right now. There are also a lot of conditions that they call it lookalikes. They look like cancer. Even in the microscope, they may look like cancer, that they are not.
So many reasons to go get a second opinion.
And that is the reason that you get second opinion. Not only for the diagnosis, you also need to get second opinion in respect to different options that now they are available for patients with breast cancer.
So when it comes to being at home self-exams, we always hear you need to, with all sorts of different things, you're always looking for changes. What kind of changes should women be looking for, even men?
Well, fundamentally, first of all, again, breast cancer occurs in both men and women. In men, naturally, the incidence is much smaller. But fundamentally, any change, and that is if you feel a mass, if there is changes in the skin, if you see that your nipple is retracted and there is a change there. Even breast pain is not associated often with breast cancer, but if there is pain and discomfort, they need to pay attention to that. Nipple discharge is another.
Right, and it matters by ages as well, what
Absolutely.
you're looking for. So thank you so much for joining us
Absolutely.
this morning.